Hey everyone, we are here at Renovus Medical Spa. We are joined by Dr. Clemons and Megan, who is allowing us to show this procedure of Instalift. Dr. Clemons, last week when we saw you, we talked about relaxing, all about the wrinkles on the face, and we even talked about Instalift, which is what we're showing today.
Correct. You know, back in school, you're taught the 3 R's, reading, writing, arithmetic. In cosmetic procedures, we have like 6 or 7 R's. Last week, you saw the relaxing with the Dysport, you saw the refilling with the Bellafill, and I talked about repositioning, okay, or lifting without surgery. So Megan's going to be here today, so we can go ahead and lift up. You can see she really has beautiful high cheekbones. She has a few little wrinkles we could address later on, but this is what was concerning her. She's just starting to droop a little bit, just starting to get down there. So what we want to do is to reposition this skin. Megan, if you look straight forward for me, I would like to go ahead and do that. So if you do this in front of a mirror every day, or this, or this, or this, that's what we're talking about. So we're talking about the Silhouette Instalift, and you'll actually see the procedure being done and some befores and afters on her. So we're going to do the procedure under a little local anesthesia. It's not a painful procedure, as you'll see when we're doing it. And the idea is to place a little suture under the skin that has some little sugar-type cones in it that will help lift up by holding under the skin. Now the beauty of this is the little suture that's put under the skin, so you can't see it, will dissolve in about 2 to 3 months, and the little cones that are actually supporting itself under there and getting in the little fatty tissue and lifting her up, they'll dissolve in about 3 to 4 months. And during that time, they're going to cause new collagen to be produced right here, so that's going to tack the skin down. So in about 3 to 4 months, what I put in will be completely gone, but she'll have new collagen here, which is going to give her a little filling, and she's going to have a lifting here that'll last about 1.5 years to roughly 2 years. Now this can be used with your other R's, all right? This is just for a lifting and a little slight fill.
Okay, and so why would people maybe choose to use Instalift instead of maybe a full-on facelift?
Because of the fact of full-on facelift, this doesn't replace the facelift. If you really have horrible sagging skin or other reasons you're not a candidate for it, then I'm sorry, a facelift would be in your need. But if you had a facelift that needs a little touch-up, we can actually do the Instalift on people who've had facelifts. And likewise, the facelift costs a lot more. There's surgery, there's downtime, there's pain, there's bleeding, there's scarring. None of that with the Instalift.
Right, and so we were talking about too some ideal candidates that you would want to see come in through your door that can really benefit from Instalift as well.
Right. Well, first of all, the non-ideal candidates. If you have very heavy skin, it's not going to hold it up very well. If you have very, very thin skin and really lax and loose, it's not going to do as well. The ideal candidate is someone who needs a little bit of a lift, probably a little more than she has, also works very well, and a little younger skin that's not really stretchy, not really, really wrinkled. Again, we can do it on these patients. They're not going to get as good a result. So it's important you come in, let's take a look, because we do have other ways of treating this too.
Right, and that's where the consultation comes in. People can always come in through your doors, make an appointment with you to get a consultation to find out what is best for them.
Right, you guys all know my office. You've been here dozens of times, all right? Come on in. It shouldn't be threatening by now. And let's talk and see what's best for you. Because again, there are a lot of different ways to treat something. I need to find the right treatment for you.
Right, exactly. And so when we come back, tell us a little bit about what we can expect to see on Megan when we come back.
All right, when we come back, I'll have some areas numbed because to put this in, I'll have little numb spots to enter. But after that, she won't be having any pain. And I'll actually be ready to go, and I'll put 1 thread in. If we have enough time, I'll put a 2nd thread in for this first time back.
Okay, wonderful. Well, Dr. Clemons, thank you so much. All the information to contact Renovus Medical Spa is right there on your screen. To find out more information about Instalift, just call Renovus Medical Spa. Thanks again, Dr. Clemons, and we'll be back here at Renovus Medical Spa.